Now we can see about the rehabilitation in plastic surgery. Surgical rehabilitation that deals with stiffness and weakness caused after a surgery. In this procedure, the treatment is given through hand in physiotherapy, hydrotherapy, or exercise or some exercise therapies. Then this will help in optimizing the pain of patients. Now we can see some post-operative instructions in general for plastic surgery patients to minimize the possibility of complications during the time, means just after the surgery or just before the surgery. How to follow some instructions like about drink alcohol, how to avoid that, then how to avoid drive a motor vehicle or operate a heavy machine, then means making important decisions. It's impossible for us and should be with a responsible person always. There must be an assistant with us, or a caregiver should be there with the patient. Then means we are waiting for the sedations to wear off, and for that we have to take adequate rest. Then you can start with some liquid, then progress to semi-solid food, then to solid food, then how to eat slowly. Suppose any facial surgery and it's impossible to have some food, means hydrated with IV fluid, then with the help of a straw we are drinking some liquid diet, then move to the solid diet. Then chew your food well. That chewing is impossible in case of facial surgery and all. Then take medications as directed. Medication also, that is based on which part of the body undergone surgery. Then about rest for first 24 hours after surgery, to take adequate rest. Then later we can climb stairs slowly but avoid strenuous activities. Then 24 to 48 hours, about that, how to shower, that is important. Then how to keep the incisions clean and how to keep the incisions dry following the surgery. And it's better to avoid shower bath, swimming pools or hot tubs at least for 3 weeks. You can have sponge bath or means a simple bath you can have. Then about the pain management, you can keep based on the surgery. Some surgeries flap and it's impossible to keep flap, means ice packs. Some case of some surgeries we can keep some ice packs in order to reduce the edema and pain. Then use the analgesics. Avoid anything with aspirin and ibuprofen. That's based on the physician's order. Then when we have to consult the physician after surgery, then once the fever is going above 101 degree, that means there is a chance for inflammation or infection, there is chance for rejection. That time you have to consult the physician. The same way, large amount of drainage or bleeding is present, sweating, the wound dressing is sweating frequently, you may consult the physician. Then pain medication is not sufficient for keeping the pain level. That time also you can consult the physician. Then special concentrations are there for some surgeries. That's of compression garments, especially for burn surgeries and all. Some procedures they require the use of this compression garments to reduce the swelling for 3 to 4 weeks. Then about the drains. For certain treatments, drains are placed to reduce the accumulation of blood or fluid at the surgical site. How to empty the drains few times per day. Then drains are typically removed with a couple of weeks of the procedure. Again, how to observe the color of the drain also. Any hole smelling is there, like that you have to observe. Then about scar management. Proper post-operative care that can minimize the appearance of scar after a cosmetic surgery procedure. As incision heal, keep the area clean and well dressed and avoid picking or scratching at the scalps. Never scratch or pick that particular part. Use an antibiotic cream to help healing. Once your incisions have completely healed, you should use a sunscreen to prevent hyperpigmentation. Moisturized materials to moisturize the area. Then you can give a soft massage on your scar to soften and flatten it. Then all other measures. In total, the post-operative measures all include relax and keep yourself occupied always, then maintain a healthy diet, means a protein rich diet, caloric rich diet you can have, avoid strenuous activities, exercises, then can have mild exercises, drink plenty of water, avoid excessive sun exposure, then eat right. Your body requires the replacement of tissues, that's why you need a protein rich diet. Then ultimate you have to take adequate rest daily. Then understand the warning signs, that is very important. Take care of the wound and take care of yourself. That's all post-operative here. Now we can see about the rehabilitation phase. The formal rehabilitation, that phase begins when the patient's wounds have healed and the patient is able to resume a level of self-care activity. This can occur as early as 2 weeks or as long as 7 to 8 months after an injury. The goal of this period are to assist the patient in resuming a functional role in the society. Rehabilitation focused activities that have been taking place during the earlier emergent and acute phase now begin in earnest once a patient wounds have healed. Among the rehabilitation, physical and occupational therapy. Rigorous physical therapy throughout the recovery is imperative to maintain the optimal joint function. Coordinate physical therapy consultation and encourage patient to develop a schedule to incorporate exercise regimen as prescribed by physical therapist. Now, the nutritional therapy. The goal of nutritional therapy is to provide adequate calories and protein to promote healing. Meeting daily caloric requirements is very crucial and should begin with the first 1 to 2 days post-surgery. The daily estimated caloric needs must be regularly calculated by a dietitian. Dietitian can calculate it and readjust it as the patient condition changes. Wound healing or sepsis, according to that, the need will vary. The dietitian will change and give the diet plan. Then psychological care. The patient and family have many needs for psychological support during the lengthy period, unpredictable period. There is a complex phase of that period is there for plastic surgery. The social worker and the nursing staff have important support and counseling roles to play during this period. Then about the pastoral care, that may be also helpful for some patients and their families. While discussing these things, some days you may be thinking, for a cosmetic surgery, why is like that? Plastic surgery involves reconstruction surgery and cosmetic surgery. Due to an accident, there is long stay for 3 months, 8 months like that for reconstruction. That these all things are applicable, the pastoral care and psychological care and all. Now, the nursing and collaborative management in the rehabilitative phase. This happens in case of burns and also very important in the rehabilitation phase. During the rehabilitation phase, both the patient and family are actively encouraged to participate in the care of the patient. Suppose in case of a burn patient, since a patient may go home with small unhealed wounds, education and hand-on instruction will be needed about the dressing, changes, wound care and all. That discharge summary we are planning and we are instructing the patient how to take care of the wound, how to clean the wound and all. If needed, home care nursing services can be arranged that can assist patient in care of wound for few weeks or few days. Then an emollient, that is a water-based cream, especially so can be a Vaseline cream that gives some extra strength for the wound that penetrates that can penetrate the dermis and should be used routinely on healed areas to keep the skin supple and well moisturized. This is for some particular cases. Okay, in general I am talking about plastic surgery rehabilitations. Then once you are using these creams, these Vaseline based creams, they helps to reduce the itching and scratching over that area, and the same way it helps to reduce the flakes formation. Then orally it's able to provide diphenylhydramine to prevent excessive irritation and itching. Now, continuous role of exercise is very important. Can't do a strenuous physical activity or exercise, then simple activity or simple exercise that is based on the surgical procedure what the person has undergone. Then reassurance is important about the patient. Then there is a psychological impact of surgery is there, injury is there. If suppose it's an accident injury or it's due to a burns injury, psychological impact is very important. Healthcare providers should be particularly sensitive and attuned to the patient's emotions and concerns. It is essential that the patient be encouraged to discuss their concerns, ventilate their feelings. It's very important. Then even after the discharge, during the rehabilitation phase through telephone, they can discuss their concerns with the social worker or psychologist or counselor. The same way care should be taken to address the individual spiritual and cultural needs, as both these phases of the patient's life play a role in recovery. That's important, the pastoral care. Then the patient's self-esteem usually adversely affected by injury, especially severe injuries. Patient needs reassurance that their feelings during this period of adjustments are normal and that their frustration is to be expected as they attempt to resume the normal life. This all about the rehabilitation. Now we can discuss about a few nursing management, that means few nursing diagnosis in detail. That first one is common nursing diagnosis of fear and anxiety that may be related to threat to self-concept, a change of the body image, or it can be due to scarring or loss of the body part, or threat due to threat of the death and change in health status. These can be the related factors of this fear and anxiety. That is possibly evidenced by increased tension, frustration, apprehension, feeling of helplessness, hopelessness, decreased self-assurance, self-focus and restlessness, sympathetic stimulation, expressed concerns regarding the actual or anticipated changes in life. These all are possible evidences. Now, our desired outcome means the client will acknowledge and discuss the concerns, will demonstrate appropriate range of feelings and will report fear and anxiety are reduced. These all are our outcomes. We can see the nursing interventions. Check out and explore what information the patient has about the diagnosis, expected surgical intervention and future therapies. This is an intervention. Second is ascertain the purpose and preparation for diagnostic test. Then third one, implement an ambivalence of concerns, openness and availability as well as privacy for patient. And so suggest that that is possible. Then next, encourage the questions and provide time for expression of fears. Tell the patient that stress related to this breast cancer or some other procedures can be persist for many months and to seek help and support from others like that. Then determine the degree of support available to the patient. Give information about community resources such as recovery research groups, some help group like that. We then encourage to women the other persons undergone the same surgical procedure. Then consider the role of rehabilitation after surgery. Now, the second nursing diagnosis, that is of impaired skin integrity, that may be related to surgical removal of the skin or tissue, then altered circulation, the presence of edema, presence of the drainage, changes in the skin elasticity, sensation, tissue destruction, that's due to radiation like that. That is possibly evidenced by disruption of the skin surfaces, destruction of the skin layers or subcutaneous tissue like that. Our desired outcome is client will achieve timely wound healing, free of purulent drainage or erythema. Then the client will demonstrate behaviors and techniques to promote healing, prevent complications. The nursing interventions include inspect the dressing anteriorly and posteriorly for characteristics of drainage, monitor the amount of edema, redness and pain in the incision. Now, perform the routine assessment of involved body part, elevate the involved body part, means if it is arm, how to elevate the arm, how to should position the shoulder properly. Think about a post-mastectomy patient. Appropriate angles, so how to keep the forearm. Means how to rest the forearm over a pillow or like that. This is an example I told. Then monitor the temperature, maintain a semi-fowler's position, or according to how to position the patient properly based on the surgery. Then how to measure the vital signs. Then observe for the graft tissue or means flap tissue. If it is a dressing is there, any blister formation is there, any drainage is there. Assess the wound drains periodically, noting the amount and characteristics of the drainage. Then encourage wearing the loose fitting or non-constructive clothing. Sometimes you have to wear some means pressure garments also. Then tell the patient not to wear a wristwatch, jewelry. The same way how to give instructions according to our surgery. Then carry out antibiotics. Now next we can see about the third nursing diagnosis, that is of acute pain, that is maybe related to surgical procedure, tissue trauma, interruption of nerves, dissection of the muscles. That is possibly evidenced by reports of stiffness, numbness and pain, shoulder pain or like that, and changes in the muscle tone. Then self-focusing, distraction, guarding behaviors. These all are possible evidences. Our desired outcome is client will express a reduction in pain and discomfort. Client will appear relaxed, able to sleep, rest appropriately. Nursing interventions include consider the reports of pain and stiffness, noting the location, duration and intensity. Note the reports of numbness and swelling. Be aware of the verbal and non-verbal cues. Then discuss normality of phantom, some phantom limb processes is there, limb breast processes is there, phantom and cut surgeries are there, means how to phantom limb sensation is there, amputation areas and that about that. Then facilitate patient to find a position of comfort. Then provide basic comfort measures, reposition of the back, unaffected area. Then means can give back rub for the patient. Then can provide diversional activities, encourage early ambulation and use of relaxation techniques, guided imagery, therapeutic touch. Then splint or support. Then some exercises, physiotherapy, coughing and deep breathing exercises, appropriate pain medications you can use. That should be scheduled as needed for the patient. Then if needed you can administer narcotics also. Then next nursing diagnosis is situational low self-esteem, that may be related to biophysical disfiguring surgical procedure or psychosocial concern about some active daily activities, possibly evidenced by actual change in the structure, body count, then verbalization of the fear or rejection of reaction by others, change in social involvement, negative feelings about body, preoccupation with the change or loss, not looking at body, means they are not able to look on that particular body part, not participation in the therapies initiated. The desired outcome is it should be like that the client will demonstrate a movement towards acceptance of self in that particular situation. Client will recognize and incorporate change into self-concept without having a negative self-esteem. The client will set realistic goals and actively participate in the therapy program. Nursing interventions include encourage questions about the current situations and future expectations, provide emotional support when surgical dressings are removed, identify role concerns as woman, wife, mother, career woman, and so forth. Encourage patient to express feelings like anger, hostility, and grief. Open up about the signs and symptoms of depression with the patient. Provide positive reinforcement for gain or improvement and participation in self-care and treatment program. Review the possibilities for reconstructive surgery or prosthetic augmentation, like that. Then ascertain feelings and concerns of other family members, and then discuss, refer to support groups. Then provide temporary soft prosthesis if needed. Now, the next diagnosis is impaired physical mobility, that is related to neuromuscular impairment, pain, discomfort, edema. Possibly that is evidenced by reluctance to attempt the movement, limited range of motion, ROM, decreased muscle tone, muscle strength, desired outcome, the client will display willingness to participate in therapy. The client will demonstrate techniques that are enable reassume the activities. Again, the client will have increase in strength of affected body parts. Interventions include elevate the affected body part, facilitate exercises, arm exercises, then how the patient how movement of the fingers or small joints like that. Then encourage the patient to use affected body part, the arm. Suppose I can discuss about a breast surgery, arm for personal hygiene, feeding, combing hair, washing, like that. Then help with the self-care activities as necessary. Then assist with the ambulation and encourage correct posture. Advanced exercises are indicated such as active extension of arm, rotation, like that. In case of arm, I am discussing. Then pendulum swings, rope turning, that type of exercises. Then teach patient proper breathing techniques, slow deep and breathing exercises. Then evaluate the exercise related pain, discuss the type of exercises, coordinate the exercise program, then assist the patient to identify the signs or symptoms of any burning, the same burning sensation or itching, like that, how to identify it. And administer the medications, that can be analgesics, diuretics, like that, refer to the physician. This the last nursing diagnosis I discussed, that's of risk for infection. Objective means the patient will be able to identify and demonstrate interventions to prevent or reduce the risk of infection. That means stress proper hand washing technique, provide regular catheter care or any care, dressing, wound care, instruct a proper wound care, that's very important. Then encourage to eat vitamin C rich food, emphasize the necessity of taking antibiotic as desired. Then closely observe and instruct to report signs and symptoms of infection such as fever, sore throat, swelling, pain and drainage changes. Inspect the wound for swelling, unusual drainage, odor, redness and separation of the suture lines. Empty and re-establish negative pressure in closed wound drains at least once per shift. These all are some nursing diagnosis and their interventions in general. Again, means one more portion is remaining in this plastic surgery, that is the differentiate between skin flap and skin graft. That from my classes you can find out some differences and you can prepare an assignment regarding differentiate between skin flap and skin graft. Thank you.